Hi friends, welcome to Nurses Online Education. Today we are going to discuss some important questions and answers for different nursing competitive examinations. So, let's get started. Here is our very first question.
A pediatric nurse is providing medication instructions to the mother of a 13-year-old boy who is starting antidepressant therapy. The mother appears unfocused, agitated and confused and asks the nurse to repeat the instructions several times. She tells the nurse that she is concerned that she might administer the medication incorrectly. The nurse is concerned that the mother is not following the instructions. Which intervention would be most appropriate?
And the options are
A. Reassure her that doubts are normal. B. Reinforce the importance of correct dosage. E. Refocus the teaching with printed material. D. Take a small break and then continue.
And the correct answer is option
E. Refocus the teaching with printed material.
Here is our next question.
A child is treated for superficial, first-degree, thermal burns to the thigh. The child is in great discomfort and does not eat. Which of the following diagnoses should receive priority?
And the options are
A. Altered nutrition. B. Impaired skin integrity. C. Risk of infection. D. Acute pain.
And the correct answer is option
A. Altered nutrition.
Here is our next question.
3-week-old infant is hospitalized with jaundice. When considering the fluid needs relative to body size of the infant as compared to the fluid needs of an adult, the nurse knows this infant requires.
And the options are
A. Less fluids. B. More fluids. C. Same amount of fluids. D. Much less fluids.
And the correct answer is option
B. More fluids.
Here is our next question.
Which of the following statement is most accurate?
And the options are
A. Girls have more ADHD than boys. B. Boys are more frequently diagnosed with chronic illnesses. C. Boys are less frequently diagnosed with chronic illnesses. D. Girls have more other chronic illness than ADHD.
And the correct answer is option
B. Boys are less frequently diagnosed with chronic illnesses.
Here is our next question.
2. A patient is recovering from surgery using spinal anesthesia. The patient developed a spinal headache. Which of the following nursing actions would be most appropriate?
And the options are
A. Elevate the head of the bed 30 degrees. B. Keep the patient well hydrated. E. Limit intake of salty foods. D. Lower the temperature of the room.
And the correct answer is option
B. Keep the patient well hydrated.
Here is our next question.
A patient is preparing for a total knee replacement. During the preoperative interview process, the patient reports an allergic reaction to penicillin. Which of the following is considered a side effect and not a true allergy to medication?
And the options are
A. Shortness of breath. B. Tingling lips and tongue. C. Rash. D. Upset stomach.
And the correct answer is option
D. Upset stomach.
Here is our next question.
Prior to providing care for a hospitalized infant, the nurse who focuses on preventive measures must.
And the options are
A. Introduce self to parents. B. Perform hand hygiene. C. Have a witness present. D. Assess the child's developmental level.
And the correct answer is option
B. Perform hand hygiene.
Here is our next question.
Was identified by Dr. Elizabeth Kubler-Ross. Which stage of dying is characterized by the transition from no, not me, to yes, me, but? A. Anger. B. Depression. C. Acceptance. D. Bargaining.
And the correct answer is option
D. Bargaining.
Here is our next question.
A 50-year-old male presents to the medical office 3 weeks after cardiac surgery with complaints of a feeling of weakness, difficulty breathing, and joint pains. Upon examination, the nurse finds a fever and a friction rub on auscultation of the chest. The nurse recognizes that the most likely surgical complication is.
And the options are
A. Neuropsychological dysfunction. B. Post-pericardiotomy syndromes. C. Cardiac tamponade. D. Phrenic nerve damage.
And the correct answer is option
B. Post-pericardiotomy syndromes.
Here is our next question.
Patient with heart failure has the following vital signs. Which of these vital signs should be reported to the physician prior to administering the next dose of digoxin? Blood pressure. 136/84 mmHg. Heart rate 48 per minute. Respiratory rate 20 per minute. Temperature 37.1 C.
And the options are
A. Blood pressure. B. Pulse. E. Temperature. D. Respiratory rate.
and the correct answer is option
B. Pulse.
Here is our next question.
A community health nurse visits a patient who had a cerebrovascular accident. The patient is at risk for deficient fluid volume due to voluntary reduction of fluid intake to avoid the use of the bathroom. The nurse educates the patient on the importance of drinking fluids and maintaining hydration. Which of the following indicates the efficacy of the nursing intervention? A. Amber color urine. B. Respiration of 35. C. Tachycardia. D. Moist mucous membrane. Answer. D. Moist mucous membrane. 419. A patient with diabetes mellitus and multiple sclerosis has been prescribed baclofen, Lioresal. The nurse knows this medication may result in A. Increased insulin needs. B. Renal failure. E. Optic neuritis. D. Muscle tremors. Answer. D. Muscle tremors. Nursing diagnosis or impaired physical mobility. B. Activity intolerance. C. Alternation of comfort. D. Risk of alternation in skin integrity. E. Knowledge deficit. Decreased cardiac output. FA patient with Alzheimer's disease and severe cardiomyopathy presents to the hospital with a fractured left hip. The patient is on bed rest until a cardiologist clears the patient to have surgery. Which nursing diagnosis have the highest priority? A, E and F. B, D and C. C, CAND, F. D, D and F. Answer. C, CAND, F. A 19-year-old woman telephones the nurse and complains of difficulty of breathing. The symptoms developed while exercising that morning. She has a productive cough with thick mucus secretions and wheezing. The nurse hears that the breathing problems do not interfere with talking on the phone. The woman plans to attend the clinic but must wait for 2 hours before she can be driven there. Which treatment should be recommended first by the physician? A. Pursed-lip breathing. B. Deep breathing and coughing. E. Decrease physical activity. D. B2. Agonist administration. Answer. E. Decrease physical activity. 35-year-old man is hospitalized following a blunt chest injury. He has chest pain, breathing difficulty and asymmetrical lung expansion. Chest auscultation reveals decreased lung sounds on the left side. The jugular veins are distended and there is tracheal deviation to the right. Blood pressure 92/54 mmHg. Heart rate 120 per minute. Respiratory rate 24 per minute. Temperature 36.2 C. SaO2 88% on oxygen. Which initial intervention is most appropriate? A. Send patient for X-ray examination. B. Administer bronchodilators. C. Administer intravenous fluid bolus. D. Prepare for needle decompression. Answer. A. Send patient for X-ray examination. 14 years old admitted 18 hours ago. 0056090348. Report at 22:45, 10:45 p.m. Remains febrile. Maximum temperature this shift 39.3 C. Respiration rate 12 to 14 per minute. Heart rate 100 to 180 per minute. Blood pressure level within baseline normal range. Diagnosis. Bacterial pneumonia. M. Next dose of intravenous anti-infective is due at 8 a.m. Refer to the accompanying figure. The nurse should plan to monitor which of the following at least every 4 hours. A. Vital signs. B. Urinary output. C. Food intake. D. Level of activity. Answer. A. Vital signs. Caring for a patient with an ostomy, the nurse knows that extra protection for peristomal skin is most important for those patients with an A. Ileostomy. B. Ascending colostomy. E. Transverse colostomy. D. Sigmoid colostomy. Answer. A. Ileostomy. Which of the following nursing diagnosis takes priority for a patient admitted to the critical care unit with diabetic ketoacidosis? A. Deficient fluid volume secondary to hyperglycemia. B. Risk of infection secondary to weakened immune system. E. Deficient knowledge of cause and prevention. D. Imbalanced nutrition related to hypoglycemic state. Answer. E. Deficient knowledge of cause and prevention. 408. A 69-year-old man is admitted to the intensive care unit following cardiac surgery. 2 hours after admission, the nurse performs a routine assessment and notes the patient's chest tube drainage is 200 milliliters and a dark red color. He has had 60 milliliters output from the indwelling urinary catheter. Blood pressure 138/68 mmHg. Heart rate 76 per minute. Respiratory rate 16 per minute. Body temperature 37.0 C. Oral oxygen saturation 94%. 6 L per minute. Nasal cannula. Which finding should be reported to the doctor? A. Dark red chest tube drainage. B. Urinary output. C. Oxygen saturation. D. Chest tube output volume. Answer. A. Dark red chest tube drainage. While caring for a child with a ventricular peritoneal shunt revision, the nurse finds the patient lying with the head and feet flexed back. The nurse should call for help and prepare for A. Spinal tap. B. Shunt culture. C. Electrocardiogram. D. Ventricular tap. Answer. A. Spinal tap. While assessing a child with pulmonary stenosis, the nurse should give priority to A. Deep tendon reflexes. B. Urinary output. C. Exercise tolerance. D. Pattern of food intake. Answer. C. Exercise tolerance. 2. A 25-year-old male patient suffered a spinal cord injury at the T4 level and is being cared for in hospital. The nurse enters the patient's room and finds the patient sitting upright and looking anxious and restless. He complains of sudden headache and nausea. Sweat forms on his forehead, yet his feet are cool to touch. Blood pressure 150/100 mmHg. Heart rate 55 per minute. Respiratory rate 28 per minute. Temperature 37.1 C. What nursing intervention is initially most appropriate? A. Assess for a full bladder. B. Lower the head of the bed 30 degrees. C. Loosen clothing and bed sheets. D. Apply heating pad to lower extremities. Answer. A. Assess for a full bladder. 403. An 80-year-old man presents to the hospital with chronic fatigue, dyspepsia and constipation. On examination he is jaundiced, has red palms, dilated veins around the umbilicus, the abdomen is very distended and he has black, tarry stool on a rectal exam. He is noted to be lethargic and have a flat tone. A paracentesis reveals clear-colored fluid with low protein content. What is most likely diagnosis? A. Gilbert's syndrome. B. Thalassemia. C. Sickle cell crisis. D. Synhosis. Answer. D. Synhosis. For more nursing-related questions and answers, please subscribe our channel.